How many of you remember David Bloom, the Iraqi reporter that ended up dying at age 39 from a DVT, deep vein thrombosis? So what's that, you might ask? First of all, it happened when he was in Iraq, and he ended up being with the troops for so long inside of a tank that he wasn't moving around a lot. It ended up causing him a leg cramp, and you can even see here he's rubbing his leg. He complained about this leg cramp 2 days before he died. They told him to go see the medic and check it out, but he ended up not doing that. Why? Because the leg cramp was coming from a clot that ended up releasing itself and traveling through his body. So the pain went away the day that clot ended up in his lungs and killed him. Unfortunately, at age 39, leaving behind a young wife and 3 young daughters. So how can you prevent this from happening to you? Well, number one, if you're a man who's over the age of 50 and you're overweight, you're already at risk. But if you're a man who also has cardiovascular disease, or you have varicose veins on your legs, spider veins on your legs, that is an indication that you have circulation problems already. So if you're planning on doing any kind of traveling, for instance, like in an airplane for more than 3.5 hours, you need to be aware of what a DVT is and how to prevent it. When you're on the plane, the pressure in the cabin is going to be lower than normal atmospheric pressure. This is what's going to allow your blood vessels to expand, and as the blood vessels expand, it allows more blood to pool in your lower extremities, especially for somebody who remains seated for a long time. So what you first want to do is take a baby aspirin. That will help thin your blood. Number 2, you want to make sure you're well hydrated. Lots of water. Number 3, you want to make sure you're as active as possible while on the plane. So every half hour to every hour, you want to do a little bit of exercise. In your chair, do some toe raises, do some heel raises, do some knee raises, raising your knees towards your face. Do about 15 reps and you'll help yourself immensely, keeping your blood flowing. So what are the possible symptoms of a DVT? With David Bloom, he had the pain and cramping in his lower leg, and you could have leg swelling or redness, but also 50% of the cases are silent. So this means this is something that you should be aware of to prevent rather than waiting for it to happen. Now, some of you might be saying, well, what about compression socks? No, compression socks for a type 2 diabetic can be bad. If you have peripheral artery disease or peripheral neuropathy, you should not be wearing compression socks unless your doctor has recommended them. The other would be if you've had a bout of congestive heart failure. Another would be a person with infections in the lower leg, because infections need blood flow in order to heal. If you're a man who is over the age of 50 and you want to get rid of belly fat so that you can get healthier and prevent problems like these from happening, then click the button below. That's my calendar. Book a call to talk with me and we can go over what your options are. And I look forward to catching you on the other side.